Thanks, Tracy. And so I think what's really important also, exactly to what Tracy was just talking about, is how we can sort of take these factors and think about them at different stages of program design. So at Digitalis Commons, we're really lucky to have the expertise of folks like Tracy and a broad group of XIRs to help advise us and our clients as they're designing programs, as they're thinking about projects to fund, products to develop. What are the right stages to think about these various criteria? So in this specific case, right? It became really important not just to get the voice of the user, the nurses in this case, but also the voice of the buyer. And really, this should be buyers, right? Because there are multiple buyers at stake here, as Tracy outlined, right? There's the hospital administrators, there's the IT administration, there's the nursing administration, there's the division business um, uh, uh, experts and finance teams. And so, really, even during the design phase, getting that voice of the buyer up front becomes really, really valuable. And then finally, also before you even start building, making sure to understand what are the implementation hurdles to get products like this into hospitals and EHR. And so doing that at the early end helps then inform the design process. So in this situation, right, if you know if you're a funder of a technology like this, if you've identified the unmet need, you want to fund this technology, maybe you're designing the program with these things in mind, you're doing the research to understand that, and then maybe you're soliciting potential performers to develop this solution. So during the solicitation, it becomes really important to make sure to design that solicitation in a way that the performers are going to be held by the standards that we know they're going to need to develop a scalable product. So not just are you, the funder, performing this analysis, but you're going to make sure to ensure that the performers will do that as well. So in the solicitation, making sure that the buyer input is a requirement on an ongoing basis, that they're going to be tracking the correct economic data that will then inform and be able to increase the sales likelihood, the buying likelihood of the buyers on the other end. And then also testing across multiple representative pilot sites so that you know that this could work in multiple different kinds of environments across multiple EHRs. And then, once that grant is being administered while it's in the performance stage, while the work is ongoing, making sure there's consistent touch points with the performers to kind of hold them accountable to these steps. A lot of times, right, the performers might are really eager just to do the work. And so it's really important as a funder that we think about keeping the performers engaged so that we know that we're aware of what product is being developed, it's being developed in the right direction, and that we can track those challenges. So that includes confirming that there's those consistent touch points with the end users and the buyers to make sure that we're continuing to assess the data that's being tracked to make sure that it actually is meeting the needs of the buyers that we learned way back in the design stage. And then making sure that we're also understanding what the challenges are, which again will influence what the sales cycle will look like once the product is actually developed. Tracy, anything else you want? Yeah,
Yeah,
please.
I was just going to add too, I think when we talk about, data in those early kind of feasibility and discovery areas, I think it's important to look at both qualitative and quantitative data, right? So things such as patient satisfaction, provider satisfaction, or worker satisfaction. Time savings is always a tough one to put an economic value on, but helping to alleviate things like burnout. These are some of the softer things of healthcare that have become incredibly important, quality measures, etc. That I want to make sure we have the audience think about those softer features as well, and an ability to sort of benchmark and then track those improvements can be really compelling as well.
Yeah, 100%. Thank you for bringing that in. Um, and so, just to kind of distill this down for this particular case study and kind of get final points here. The voice of the customer and the buyer matters at all stages of the process. Before even even if you think about funding a program, before you start building it, during that build, and then even while it's being built, and even into the sales cycle. So it's important to get that feedback and input all across that spectrum. As Tracy really outlined so well across this presentation, the healthcare value chain is incredibly complicated, as she outlined. And so making sure that you're mapping out who are the relevant stakeholders, who stands to gain, who stands to lose by these, in these various sectors, and understanding uh, that'll help you understand what the barriers are to get a product adopted. And it's really important to understand that at the earliest of stages. And then finally, making sure that you have a representative sample of customers. So you're not building something, designing something for a single customer. And that's particularly true in digital health solutions, but that's true, I think, across all of the asset classes that Tracy spoke of at the very beginning of the presentation. Tracy, any other like sort of final distillation points? Yeah, please.
I think on that third bullet in particular, I think a lot of innovation happens in larger academic medical centers or research groups. I really encourage folks not to forget about community health systems and how their economics, buyers, and challenges might differ, different regions of healthcare, where you may have different patient profiles or different considerations. Making sure, as you said, to sort of sample across different, not one hospital represents all types of hospitals, and thinking very sophisticated in very sophisticated ways about how to carve up that market and do your diligence in those different profiles and phenotypes is really important.
Yeah, yeah, thank you. So yeah, again, summarizing here, um, in this particular case study, although the software was developed that could have improved outcomes in nurse safety, it didn't sustain or scale because the economic data that Tracy spoke of was not there to incentivize the ongoing purchase and maintenance of that software. And so making sure that we're doing the design while also understanding that research becomes necessary to know what data we need to collect to then incentivize the long-term buyers. And I mean, Tracy really just, I think, brought in this point perfectly, right? Which is that it's really common for technical experts in their unique space to build towards their unique space. And so making sure that we're broadening out the expertise beyond the technical expertise to make sure we're bringing in all of the different considerations for why a technology will be adopted. And that includes the knowledge of buyers. And I think Digitalis Commons is particularly suited to help support funders, to help support performers in thinking through what are the things that they need to think about to make sure that that product is actually going to reach patients and clinicians. And in part, we do that so well because we have the expertise of people like Tracy and other XIRs that really have a depth of understanding to provide that guidance to funders and to performers. So Tracy, I don't know if you want to just close us out and give a quick summary based on this framework.
Yeah, and again, hopefully seeing it again helps to reinforce some of the challenges and considerations. And I think it's a great way to start to beyond the technical milestones and the things that I think, as Justin said, you can sort of map out and sort of have a little bit more of a linear thought process. There's a lot of complexities here with even within something such as, looking at industry. There are a lot of pieces of industry. All of these have subtypes and subcategories to consider. So really doing your homework up front on commercialization about stakeholders. That does not mean someone who has to purchase or extend or invest in a solution, but may play a role in getting it to be scale and to touch as many patient lives as possible. And how do you think about that early on in your process? So hopefully the framework provides a way for you to create questions, engage experts such as Digitalis Commons, and really help to support that early commercialization for long-term success.
And so, yeah, I mean, I will also invite you if as you're thinking about your program design, performers that you might have, products that you might be developing, how you might be thinking through this issue. But yeah, thank you so much for joining us for this conversation. I hope it was helpful. I always learn a lot when talking to Tracy, so I'm grateful for the opportunity to do this with her.
For having me. Great.
Yeah, thanks everybody.